Hello, everyone. I'm going to show you my PowerPoint presentation about my topic in regards to the ethical considerations. And my specific topic is ethical issues with electroconvulsive therapy, or better known as ECT. So a little introduction to electroconvulsive therapy is it's a type of therapy used for decades at this point to help treat behavioral issues for those with autism spectrum disorder or other learning disabilities. This form of therapy for decreasing problem behaviors or implementing behavior modification has been a controversial topic, which has been a huge reason why I felt led to this topic, and it has led to the continued research for uh, its effects for successful therapy. And there's a plethora of research out there and make cases for both positive and negative usage of ECT, and I'm going to talk about one of each today. So a little history of electroconvulsive therapy was originally not, it wasn't founded in the field of ABA. And, it's natural, I guess, speaking for myself, to think that it started in ABA. However, due to its age, it started in the field of psychiatry. And about 80 years ago in Rome, these two scientists, psychiatrists specifically, and I may be butchering their names here, but Ugo Cerletti and Lucio Bini were the ones who first experimented upon using electric current to elicit an epileptic seizure for therapeutic purposes. With that said, despite them being the ones to discover, inducing those epileptic seizures for therapeutic purposes, there's actually Ladilas Maduna, who was also a psychiatrist, who founded the idea of using this form of treatment towards patients. Going more in the future here, closer to our time, the beginnings of using ECT for treating symptoms of ASD, they dates back to the 1940s. There were studies that were done in France and New York on the usage of ECT during that time for those who displayed a variety of mental disorders. And autism was not technically labeled as one of them. However, due to the different criteria for diagnosing autism, there were those who were diagnosed with Asperger's, and they had similar symptoms as far as uh, limitations with social skills and uh, certain comprehension skills, but mainly social skills. And again, very similar to autism. So the studies done for that were very helpful for learning about the development of ECT for the field of ABA. And these were studies in both Paris and New York City, and they included mainly other mental disorders such as schizophrenia. So, like I said, like they did have those who were diagnosed with Asperger's, but it was mainly schizophrenia or those who had depression episodes. With that said, it was still the beginning of learning about the potential effectiveness of ECT towards patients and reducing symptoms for mental disorders. So, arguments for ECT in the study conducted by Wachtel et al., their findings were consistent with ECT being effective for those on the autism spectrum. Specifically, in this study, the argument was made for ECT helping with the reduction of self-injurious behaviors. And the participant in this specific study was an 8-year-old boy who engaged in high rates of and high frequency of self-injurious behaviors. The method of the study included starting with consent due to his age, obviously had to get consent from the parents, and there are two child psychiatrists who were part of the study and implemented the ECT. And due to the success of previous studies showing the success of bitemporal electrode placement, so little placemats on the side of the head, the psychiatrists implemented the same placement and the different drugs included with ECT for both muscle relaxant and seizure induction. So over the course of 5 weeks, there are 3 treatments a week, making it a total of 15 treatments. And the overall summary of the results, where it did help with overall reduction of SIB. And this kid was able to, he went from not being able to participate in educational activities to be able to participate in educational activities. So despite having successful stories and hopeful stories, there are definitely studies, as I mentioned in the introduction, there are definitely studies out there that go against it. And the success, excuse me, and the study specifically, and that's shows results against ECT, is specifically about 32 people who met specific criteria, and those who were on the ASD or intellectual disability. They were given ECT once per month following 3 different sessions and receiving acute ECT. So after after a couple months of receiving 1 session a month, then they received acute ECT, just more frequent ECT. And additionally, there were 2 individuals under the same ASD criteria who were given biweekly treatments versus monthly treatments. And the entire purpose of this study was implementation of ECT was to help treat catatonia, or high frequency of involuntary movements. The discussion of the study, there were positive effects with low-term risks for those diagnosed with mania, depression, schizophrenia. So like the studies in New York, there were other mental health issues included. However, the researchers were showing low application towards ECT for those with ASD, and the next slide will explain why. One of the specific reasons included the lack of consistency for ECT. As part of the study, methods included individuals with ASD receiving monthly treatment versus biweekly. So in other words, it's a lack of consistency. So that it's possible, it showed that there were differences in effects if those who did not have access to ECT, it wouldn't be effective. And so that was a problem. But the next reason is more compelling, and it dealt with the neurological effects of the brain. And it dived into the neurological differences of those who have ASD versus those who didn't, and the implementation of ECT, taking into account those neurological differences, could potentially interfere with overall brain function and even worsen the symptoms of ASD. So potential ethical violations. So there are 2 ethics codes I thought that would be potentially violated from implementing ECT based off the results from the studies against ECT. And the first one is Ethics Code 2.01, providing effective treatments. This code refers to the importance that each behavior analyst has for providing treatment for clients that are not only helpful for clients, but are scientifically based. It is also crucial for behavior analysts to recognize their accountability towards protecting the clients and all those involved. So yes, despite there being positive treatment for ECT for those with ASD, there are also damaging effects. So the fact that there are damaging effects out there and it's science-based, that knowledge, knowing that, it would be an ethical violation. It would be an ethical violation due to not keeping the client entirely safe. And the next code is responsibility to the clients. So specifically, this code focuses not only on protecting the rights of the clients, but to do no harm. And again, if it can be harmful for those with ASD to receive ECT, it's an ethical violation to proceed. So the stated professional stance on ECT. So on this specific topic of ECT, the ABAI made a statement in regard to the determination of implementation of ECT. The statement they made has been an added testament towards the ethical violations that would be done upon usage of ECT. Again, I'm confident that those on the board recognize that there have been studies to prove the effectiveness of decreasing behaviors, but there's more to it than just decreasing behaviors. They see that there are negative effects and harmful effects, and therefore it is damaging to clients and it needs to be terminated. So my personal stance is Upon learning about ECT, I've not only come closer, I'm fully convinced that it is unethical. And when I was a new RBT, I learned about a, a client that before ABA was given ECT, and it did decrease behaviors, but parents were concerned about the long-term effects. And that's when I learned about the importance of differential reinforcement and preventing any type of punishment. And I do stand that this type of therapy is punishment. And thank you for watching.